A smile can tell you a lot about someone. It offers clues on what they're feeling, their general demeanor, and it can even tell you a lot about their overall health. For example, halitosis or bad breath can be a sign of poor oral hygiene or even more serious gum disease. The way we swallow our food, something we take for granted, can have an effect on the alignment of our teeth. This is why we need to give our oral health the best care possible, as it is a lifelong commitment. We'll talk about proper oral hygiene habits and procedures for good oral health on the program today. I'm Dr. Freddy Gomez and welcome to MedTalk Health Talk on CNN Philippines. Good oral health plays a part in how we look as well as how we feel. Now, our guests are here today to give us effective tips in keeping our teeth and gums strong and healthy. With us is Dr. Lucila Bernardo. She's a dentist from the Bernardo Dental Office. We're also joined by Dr. Maria Cristina Flores, who is an orthodontist from the Makati Medical Center. Now today we're going to be talking about our teeth, which is one of the, if not part of our body. Now just because our teeth are very strong doesn't mean na hindi dapat ito alagaan. Because in the Philippines, oral disease continues to be a serious public health issue. Now, the Department of Health reported that over 90% of Filipinos have tooth decay and over 70% have gum disease. I'll start the discussion with Dr. Bernardo. What do you think are some of the factors that nagko-contribute dito sa poor oral hygiene situation among Filipinos?
Number one, we have so many poor people in the country, especially here in the city, that rather than buying toothbrush and toothpaste, they would rather buy food that will be sufficient for their tummy. But comparing to those people in the faraway distances wherein they have a backyard gardening, you will notice, and I have noticed, that they have good teeth, even if they don't brush their teeth.
But we can't stress enough that oral health needs to be prioritized. What are some of the primary causes kaya ng tooth decay naman, Dr. Bernardo, which is common na nakikita natin sa mga bata?
The diet of the children here, especially in the rich people, they can eat anything they want. And then they don't really see to it that their children are brushing their teeth properly. So that's one reason why children now have more cavities than before.
But speaking of children, lately pediatricians nowadays are having a good professional relationship with dentists, especially when it comes to children and preventing early problems with their teeth. Dr. Flores, why is this so?
A lot of pediatricians are now aware to refer children as young as 1 year old to the dentist. Not because of the teeth, but we need to educate the parent also, especially if it's their first child, that the oral hygiene of the child is very important and to take care of the deciduous or baby teeth.
Maybe a lot of parents nowadays do not overly emphasize on the care of the baby teeth of their child because sa utak nila, Dr. Flores, mawawala din naman ito. What is the risk with this line of thinking?
I actually hear that very often na baby teeth lang naman yan, hindi naman yan kailangan. It actually is very important because it serves as a guide for the eruption of the permanent teeth. So early on, you need to take care of the baby teeth so that you also have healthy positioning of the permanent teeth.
Now I'd like to address a common concern for a lot of individuals, and that is halitosis or bad breath. Ultimately, this affects a person's confidence and quality of life. Dr. Bernardo, what are some of the factors behind itong bad breath?
One is your health condition that can elicit in the mouth. And of course, poor oral hygiene, if you don't do proper brushing and flossing, and also the food you eat, like, for example, garlic, that will be very strong. And even if you brush your teeth, it will elicit still in your breath.
Every person is unique. Your smile is a big part of the whole picture of what makes you special. But what is a normal smile? We hear of an overbite, an underbite, too much teeth showing, too much of the gum line showing, or not enough. Dr. Flores, can you explain to us what an ideal smile should look like?
An ideal smile is unique to each person. Basically, it should follow function first. The teeth should be able to chew the food that we eat or mastication. Secondly, it should look pleasant when you smile. One person cannot have the same smile as the other. So each dentist should individualize the smile for each person.
Dr. Bernardo, what should we know when it comes to brushing our teeth? Paano ba yung tamang paraan ng pagsipilyo? And is flossing just as important as brushing our teeth?
You have to floss your teeth very well so that the big chunk of food that are caught in between your teeth are removed first, and then you go to toothbrushing. And you have to use a soft bristle to avoid hurting your gum. Because brushing, especially at the back area, you have to close your mouth a little so you can really manage to clean the inside part and also the outside part near the cheek.
Now, when it comes to toothpaste, there are so many to choose from. Now, what is important though is that it has fluoride. Dr. Bernardo, tell us more about this because there's been some misconceptions about fluoride in the past. Is this one of the most important things to look for when it comes to toothpaste?
It really helps your enamel, no? But there are patients who are allergic to it. So you have to tell them also to check on what toothpaste they should use. I always recommend them, if they have allergies, to buy a small packet first or a small tube to try it, which one will help with them. Even if fluoride is very useful, but if they're allergic to it, then you have to tell them to stop it.
Maintaining your oral health is a lifelong commitment. When we return, we'll talk about common procedures done nowadays for healthy teeth and gums. You're watching MedTalk Health Talk, your partner in healthcare.
SMC, San Miguel Corporation. Bisag unsang industriya ang sudlan niini, tinguha sa SMC ang pag-uswag o paglambo sa mga Pilipino. Karon, gikan sa SMC, aniya na ang SMC Davao Cement. SMC Davao Cement. Gama sa Davao, para sa Mindanao. SMC Davao Cement. Ato ni Bay.
I'm Dr. Freddy Gomez and welcome back to MedTalk Health Talk, where caring is our calling. We all know that good oral health can prevent cavities as well as gum disease, but it can also prevent more serious diseases, costly procedures, and of course, it keeps your smile bright. The key is understanding the benefits and the limitations of a certain procedure. Now, brushing as well as flossing your teeth is a sure way to keep your teeth clean, but it can't match the way your teeth will sparkle and shine after having your teeth cleaned at the dental office. Dr. Bernardo, how much cleaner can someone's teeth get with a teeth cleaning session at the dentist chair?
We really see to it that all the plaque, especially under the gums, are completely removed. And we explain it also to the patient why we have to do it, because sometimes it's really painful, no? And sometimes we give anesthesia to do it well. And we always tell them to visit us more regularly, especially if they are plaque builder, at least every 3 months or 4 months rather than every 6 months.
Could you briefly describe to us what plaque is? Bakit ito masama at hindi ba ito natatanggal with regular toothbrushing?
Not really. No, they are hardening on the surface of the teeth caused by our food intake and the saliva. Some saliva are more acidic and they're easily formed plaque. And we really have to help patients to remove that.
Please explain to us what braces are basically. What's their purpose? How do they help in oral health care?
Braces basically are removable or fixed appliances that move your teeth if they are not functioning properly. So if you have overlapping teeth, it interferes with good gum health. So you're going to have to move the teeth with the use of fixed appliance, which are the brackets, or a removable appliance, which are retainers.
Dr. Flores, when a parent hears those 4 words, your child needs braces, many parents may get anxious because of the cost the procedure might entail. Are there any less costly alternatives to braces that are still as effective?
When a parent comes to the orthodontist, it's most of the time too late. They bring their child at 13 or 15 years old thinking that they need to have all the permanent teeth erupted already. Actually, it's best to bring them early, 7 years old or 8 years old, for an initial orthodontic screening. Because at that age, you can actually redirect bone growth. You can actually help the eruption of certain teeth, which will avoid costly fixed brackets.
Is having a perfect white smile the only purpose of getting veneers? What are some of the pros and cons to having this procedure done?
It is much cheaper than braces, no? Because we can straighten, and especially those discolored teeth that cannot be corrected by bleaching can be corrected with veneers. It's really beautiful once you're done, and but you have to explain it very well to the patient, the ups and downs of veneer. Once you have the veneer, you cannot just bite like corn on the cob or munch on chicken bones or things like that. And I always require them to wear a mouth guard.
Dr. Bernardo, when it comes to veneers, is there anything permanent done with the person who wants to get veneers? If several years down the road, they just feel that, okay, I don't want these veneers anymore, and they just remove it. Is that all that's needed?
No, it's impossible. Once you have the veneer, your teeth are already ruined because we shave off your enamel. At least we shave it like 1 millimeter, so you reduce the enamel. That's why you develop hypersensitivity to cold and even food that you take.
Now, another common procedure is teeth whitening. Dr. Flores, I'd like to ask you about this because teeth whitening can also be achieved with a visit to the dental office, but I'd like to compare and contrast this with those do-it-yourself kits that can be purchased online. Are there any risks to doing teeth whitening at home?
There are many brands in the market which use different materials. So varies actually based on the percentage of the whitening solution. So it's always best to consult your dentist. Never do it on your own.
How important is it that someone or a child who needs braces have it done with a truly qualified orthodontist?
You can't just put braces. So there was, I think, a trend recently wherein you buy your brackets online and then you put it on yourself. So you have to understand bone movement and tooth movement. You can't just put braces just because you feel like you can do it on your own. So you need to go to a qualified orthodontist for you to be able to achieve what you are looking for in a perfect smile.
Now, brushing your teeth and flossing daily are essential in keeping your teeth and gums clean and strong. And having procedures done by qualified health professionals can get that extra step. But it takes more to maintain your oral health. More on this when we return. Your health is our mission here on MedTalk Health Talk. We'll be right back.
SMC, San Miguel Corporation. Bisag unsang industriya ang sudlan niini, tinguha sa SMC ang pag-uswag o paglambo sa mga Pilipino. Karon, gikan sa SMC, aniya na ang SMC Davao Cement. SMC Davao Cement. Gama sa Davao, para sa Mindanao. SMC Davao Cement. Ato ni Bay.
I'm Dr. Freddy Gomez, and this is MedTalk Health Talk, your partner in healthcare. Today, we're talking about practical and effective ways to maintain proper oral hygiene, and as a result, avoid serious health issues and costly dental procedures. Now, we spoke about brushing our teeth and flossing daily to maintain oral health. But Dr. Bernardo, what are some other practical tips that you could give us in order to prevent oral problems in the future?
It's really necessary that you brush your teeth very well, but not only brushing, but you have really to use dental floss. And if you can avoid sweets, there are times that you're just so lazy and after eating those sweets, it stagnates in between your teeth and that's the cause why you develop cavities.
Bakit twice a year kailangan makita ang isang dentista?
Your dentist actually can catch starting cavities early. If they catch it early, it's such a minimal procedure. You don't need to undergo costly procedures in the long run. So if you see your dentist at least once or twice a year, you'll be assured that you'll be able to take care of your teeth properly.
When we're out and about, ano ba yung dapat nakasama sa toiletry kit or oral hygiene kit na essential?
Even if you travel, even if you're inside the airplane for 13 hours, you have to really floss and brush your teeth. So you have to carry that essentials, your toothpaste that you're not allergic with, your dental floss, and your toothbrush.
When it comes to braces now, a lot of people pretty much know that you have braces on or you're undergoing braces. And for some children during that stage in their life, this can be very awkward. Kumbaga, no? What's the latest technology when it comes to braces? Is it less visible now? What is used nowadays?
There are aligners, which are more or less new right now, but I would not recommend it for all cases. They're there for simple cases, but I would still recommend fixed brackets. But if you are thinking about braces, you would need to consult your orthodontist early on. So there are times wherein you can avoid having braces altogether.
How young can a person have their braces attached?
Normally, I have my patients see me around 7 or 8 years old just to be able to assess and look at their bone growth, but no fixed appliances yet. If necessary, I can redirect their bone growth to actually remove the need for the braces. But if it is necessary, then the braces come in around the later part of the teenager's life, and it usually lasts a very short time.
Now, Dr. Bernardo, I'd like to ask you, we've been talking about brushing our teeth for the show, but we've sort of neglected the gums a little bit. What are some symptoms that our viewers will be able to notice na kailangan nilang pa-check yung gums nila to prevent any form of gum disease?
You can develop gum disease and that is swelling of the gums. You will notice also bleeding of the gums. So it is a coordination between the medical practitioner and the dentist to advise the patient to see us.
How are dentists nowadays adapting to the pandemic?
We provide so many new things in the office to be sure that they are safe when they enter our office, and we see to it that they also have been vaccinated and haven't visited any or have been in association with any patient with COVID.
Now, before we go, Dr. Forrest, do you have any advice, any tips for our viewers, especially those who are thinking of doing any procedures such as braces, teeth whitening, or even veneers?
My tip is don't be afraid of your dentist. If you go to the dentist early, we can avoid a lot of the painful procedures and a lot of the costly procedures. If you have children, bring them in early so at least they're already accustomed to seeing the dentist on a regular basis for their cleaning.
And Dr. Bernardo, do you have any tips or advice for the viewers, especially when it comes to oral health, teeth care?
I would advise them to visit us regularly, depending if you are a healthy person or a sick person. Sick person needs more visit, but healthy person needs at least twice a year to see to it that their gums are well and their teeth are stable.
Remember, keeping your mouth clean affects more than just your teeth and gums. Reduce your risk of cavities, gum disease, and other problems by taking the time every day to care for your oral health. Thank you, Dr. Lucila Bernardo and Dr. Cristina Forrest, for being with us today and sharing your tips and insights. I'm Dr. Freddy Gomez, and thank you for watching MedTalk Health Talk. We'll see you again next time.